We're going to go straight to the front of the Sydney Morning Herald. Now, there's a couple of big issues at stake here, and I'm interested in your thoughts on the three major stories on the front page of the SMH. Let's go with the splash. Virus cases spreading inside New South Wales hospitals. COVID-19 clusters are blooming within several Australian hospitals as the virus spreads between staff, patients and their visitors from untraceable sources. Undetected coronavirus cases have infiltrated wards and units in New South Wales, Victoria and Tasmania, sending hundreds of exposed healthcare workers into quarantine as staff and patients report lax policing of screening and distancing rules within some facilities. That's it's a bit of a wake-up call there, Matt.
Oh, it absolutely is, Gleeso. I mean, throughout this whole crisis, I think really the biggest issues appear to have been in New South Wales and in Victoria, and we're seeing that again here as well as Tasmania. But particularly when it's in our hospital system, I think, Gleeso, this is of real concern. Now, I mean, I can speak from my experience up here. I was at the Royal Darwin Hospital a couple of days ago, and the measures they had in place there were quite remarkable. No one was getting inside that facility without doing a temperature check. Front door. There was staff at the entrance who were wearing gowns and masks. Really, you couldn't get near the joint unless you'd been through a pretty serious checking process. So I think that the problem is probably that those sort of measures are not in place across the board. I think there's another story that is perhaps on the front page of the Daily Telegraph about a staff member at another hospital in New South Wales who'd been working there for 5 days and had actually infected probably 12 people or more over that period. So there's some issues there. One of the big concerns with this virus, of course, Gleeso, is that often people are asymptomatic. They've got the virus for several days before they start showing symptoms. So in a lot of cases, people can have this virus and not even know it. And of course, we haven't been testing people unless they're symptomatic in most cases. So, that's where this issue is coming from. And obviously, community transmission is becoming a serious issue, particularly in New South Wales.